Today is a pleasant day, and I want to keep asking you about status epilepticus in children. Sit down, please. We begin. What is the classic definition of status epilepticus?
One continuous seizure or two or more seizures that last more than 30 minutes without returning to basic level of consciousness.
Let's say you see a child in the emergency room who has seizure for more than 5 minutes. How will you determine his seizure?
Brief seizure, less 5 minutes, prolonged seizures, more 5 minutes, operation definition of status epilepticus.
This is absolutely correct. If a child has a seizure that lasts more 5 minutes, you should assume the patient is in status epilepticus and start treatment as soon as possible. If you observe the start of a seizure, you should begin timing so you know the right time to start administering medication.
I was reading this thread all evening yesterday, but I always think that theory is different from practice.
You're right. So I try to ask you practical questions. Why treat a seizure early?
The risk of cardiopulmonary complications increases. If the seizure lasts more 5 minutes, is less likely to resolve on its own.
And thirdly, as the time passes, the medications used to stop the seizures are less effective. What type of seizures do we see most often in status epilepticus?
Status epilepticus can present with different seizures types. Most commonly you see generalized convulsive.
How would you describe this condition?
As a rhythmic pattern of contraction and extension of the arms and legs, occurring while the patient is unresponsive.
Thank you. It's enough for today. Tomorrow we will continue. Have a good day. Goodbye.